Good day, class. In this video, we are going to discuss the etiology as well as the treatment of hypertension. Similar to the other diseases, when we study the etiology from traditional Chinese medicine point of view, we have to understand the possible causes, the location of the diseases, the affected organ of the diseases, and as well as the syndromes. The syndromes will be categorized into two aspects. One's deficiency, one's excess. So the deficiency may be the kidney deficiency, such as the kidney yin deficiency, the spleen deficiency. The excess can be the hyperactive liver, improper diet, emotion, etc. So when we're talking about hypertension specifically, the deficiency more related to the kidney deficiency, the excess will relate to the hyperactive liver yang, improper diet, as well as the emotions, excess emotions, such as anger. So sometimes you can see from our daily life, the blood pressure going to increase dramatically after fighting or arguing. The blood pressure going to increase, and all of a sudden the patient got stroke after fighting with others or arguing with others. Apart from these syndromes, the possible causes also very important, because in order to develop into these syndromes, for example, the excess emotion, where does the excess emotions come from? The patient must have a history of excessive emotion, such as angry, or the one we mentioned, the fighting with others. Or if you diagnose from improper diet, the patient must have a history of improper diet intake. That's once that one student asked me for the lower back pain, and the lower back pain, and then the student diagnosed as wind cold attack, because the cold can result in E syndrome. That's correct. But when we diagnose the wind cold attack, where does the wind cold come from? The patient must have a history of the wind cold attack, or possible history, such as the environments, or they don't dress enough during the cold weather, then that's possible. Otherwise, you need to think some other possible causes. Is it the pain is due to wind cold or internal coldness? Because these two are in different categories. One is exogenous, one is endogenous. No matter which one you decide to select, you need to find the possible cause, the possible history that may result in this syndrome. The main symptom of hypertension, the patient may have no obvious symptom. Due to liver fire, dizziness, headache, irritation. That's why when we study the headaches, dizziness, or vertigo, I said that we need to exclude the secondary headaches. One of the secondary headaches is from hypertension. A red facial complexion, red eyes, bitter taste, constipation. Bitter taste is also from the liver fire. Constipation, red tongue, dry yellow coating. These two syndromes, due to liver fire and due to hyperactive liver yang, these two are very similar. The hyperactive liver yang, especially also a kind of heat, a kind of fire, but this fire is deficiency fire. So although they will have similar manifestations of heat, but because one is excess, one is deficiency, the liver fire is excess. So the treatment principles will be reducing the liver fire. That's the treatment principles for hyperactive liver yang. We will nourish the yin. In the meantime, we may reduce the heat. But the dominant treatment will nourish the yin. Also, that's the root cause. The yin deficiency may be the liver yin deficiency. The liver yin deficiency may affect the heart yin, result in insomnia, palpitation, may result in kidney yin. The yin deficiency, the patient will have the feverish sensation in palms and soles. Tinnitus, also from kidney yin. Due to phlegm, that's also excess. Dizziness, headaches, heavy sensation, chest tightness, palpitation, that's the phlegm block the heart or block the chest. More specifically, the phlegm block the stomach and spleen, results in nausea, vomiting, white greasy coating. These are all phlegm. Due to qi deficiency and blood stasis, this is the combination of excess and deficiency. So the treatment principle will be tonifying the qi and activating the blood circulation. We can use the combination of reducing and reinforcing. Due to yin and yang deficiency, especially the kidney yin and kidney yang deficiency. Treatment principles: hyperactive liver yang or yin deficiency, tonify the yin, reducing the hyperactive yang. So we use the combination of reinforcing and reducing. Tonifying is kinds of reinforcing. Reducing, we use acupuncture and with reducing manipulation technique. Due to phlegm, we need to tonify the spleen because that's where the phlegm comes from. In the meantime, we need to clear the phlegm. So in this treatment is the combination of treating the root cause and the manifestations. We can use the combination of acupuncture and moxibustion. Qi deficiency and blood stasis, tonifying qi, activating blood. Combination of acupuncture and moxibustion with reinforcing and reducing. So we use both techniques depends on specific points. For example, the level 3, large intestine 4, we can use reducing technique. Large intestine 11, spleen 6, we can use reinforcing. Due to yin and yang deficiency, tonify yin and yang, combination of acupuncture and moxibustion with reinforcing manipulation technique. The main points, one of the key points is stomach 9, 人迎. We have introduced how to insert the points, 人迎. Very special attention must be paid to the insertion of 人迎. This point is dangerous if it is inserted improper. Apart from 人迎, you can use Du20, large intestine 11, large intestine 4, level 3, spleen 6. Spleen 6, that's from spleen meridian, can tonify the yin organs. Another reason why we use spleen 6 to tonify is because most of hypertension patients, they are not young anymore. It must be, or they I can't say must be. In medical terms or explanations, we don't really use such a must or 100%. We don't be, so when we talk everything, don't be that confident. But more commonly, patient will be above 40, above 50. So as we become older and older, the patient may develop into deficiency. So we can use spleen 6 to tonify the kidney, the liver, and the spleen. That's why we use reinforcing in spleen 6. But all these points, the key points is stomach 9. The insertion of the stomach 9, the direction is very important. The depth is also very important. As we mentioned previously in the practicals, the qi arrival is the jumping of the needles. Okay, you don't insert too deep, and no need to insert too deep. Even 0.5, that's enough. But you must see the needles jumping. Due to hyperactive level yang, you can add gallbladder 20, level 2, insufficiency, kidney 3, bladder 18, especially liver, kidney and liver insufficiency. So this is the combination of the back-through points and the yuan source points. Due to phlegm, you can add stomach 40, stomach 36. Stomach 36, the spleen, as stomach can tonify the stomach as spleen, reduce the phlegm, reduce the formation of the phlegm. Stomach 40 can clear the phlegm due to qi deficiency and blood stasis. Spleen 10, bladder 17. As you can see here, the diseases that we have already introduced. Wherever we mention blood stasis, we can use bladder 17 due to yin and yang deficiency. Ren 4, bladder 23, we can use Moxibustion or acupuncture with Moxibustion, especially the acupuncture with Moxibustion, especially the one needling technique. Accompanied with palpitations, you can use pericardium, heart 7. The other treatment techniques, skin needling techniques, you can use 3H needling technique, auricular acupuncture. These are all something you can consider. It is very important that the patients are not suggested to stop taking medication immediately after acupuncture treatments. There's one case from Tianjin University of Traditional Chinese Medicine. They conducted a research on hypertension patients between 2009 to 2010. It includes 188 cases. They divided into 3 categories, 3 groups. One is with acupuncture on both stomach 9 with the manipulation technique for 30 minutes. The control group with the medication, and the third group, they insert the needle on stomach 9, but they don't manipulate. And the results from the acupuncture group with the manipulation, the blood pressure going to start to drop in 3 minutes. And it can maintain for a few hours. So that's the before the SBP, before the treatment. Acupuncture group, control group, the control group with the medication, the acupuncture group without manipulation. After 3 minutes, after 15 minutes, you can see the blood pressure can drop dramatically, almost back to normal. After 30 minutes, after 60 minutes. That's also why these 2 groups, one is acupuncture on the same points of stomach 9. The second group is the acupuncture points On stomach 9, but without manipulation. See the difference on the same points. The only difference is the manipulation technique. That's why the manipulation technique is very important. You need to train yourself. After 2 hours, after 4 hours, after 6 hours. As you can see from this research, that the blood pressure going to start to pick up after 6 hours. That's why we need to conduct again the second treatment here. So for this situation, acupuncture treatment need to be done twice a day. And then you can maintain. So this is also another issue. That's why we need to maintain the frequency of the acupuncture treatments. It is not suggested that acupuncture treatment can be done once a day or once in a week. It's not scientific. It's not the truth. This is quite reasonable because for example, the tablets, you need to take the tablets even for the blood pressure. You need to take some of them, you need to take once a day, some even twice a day or 3 times a day. Although now with the technology, sometimes we can change the technology can change the forms of the tablets. They can make the tablets which you're supposed to take 3 times a day into use the technology to change the shape or the releasing forms of the drug you can take once a day. But no matter which type of the medicine, you need to repeat after a certain time. Same as acupuncture. Acupuncture is not magic. You have to repeat in certain time with certain frequency, certain duration. From this table, you can see the importance of the manipulation. With the same points, the dark one is the acupuncture with the manipulation. This is acupuncture without manipulation. This on the same points. The yellow one is with the junk. As you can see the results, this acupuncture with the manipulation can maintain the best results. Although it starts to pick up after 6 hours, you need to apply a second treatment. The manipulation technique for stomach 9 is also very important. We don't use large amplitudes of the lifting and fasting. We use light manipulation, soft manipulation, and high frequency. So that we have introduced in the practicals. From this research, you can see the efficacy for acupuncture from the treatment of acupuncture for hypertension. You also can see the importance of manipulation technique when performing acupuncture. The acupuncture can be used for hypertension. But I have to say that although acupuncture can be used for hypertension, but sometimes we also need to consider the convenience, the cost of the treatments. There are a lot of studies need to be done on these treatments because the hypertension can be reduced, the blood pressure can be reduced, but how long can you maintain? How many sessions we need to do for that patient? So there are a lot of studies that still need to be done. When you search on the articles, there are many different points of views on there. In future, you may also work on the research in that field to contribute to the treatment of hypertension from acupuncture point of view. Thank you for your attention.